Thank you so much for staying tuned to CAST TV. We always appreciate the time you spend with us here. Welcome to Ketesiet Never Tililinda. My name is Cheptai Kirui. I'm standing in for Chesang Karo, and as she has already informed you, today I'm joined by a distinguished guest. She is the director of the UNAIDS Regional Support Team for Eastern and Southern Africa. With over 2 decades of experience in international development, including roles with the United Nations Development Programme, our guest is a renowned expert in gender equality, global health, and women empowerment. Currently, she's at the forefront of the fight against HIV and AIDS, bringing with her a wealth of knowledge and insights to our discussions. And I have the privilege of engaging with her today on critical issues such as the prevalence of HIV among women, challenges faced by our young girls and adolescent girls, and what is being done and actually needs to continue to be done to combat these issues. Without much ado, join me in welcoming our guest for today. Her name is Githuku-Shongwe, who is joining us all the way from South Africa. Happy International Women's Day, and thank you so much for making time for us.
Thank you so much, Mtai. Thank you for the opportunity to join here and to your listeners and your audience.
Yeah, and it's really good to speak to you on this special day when women around the world are being recognized for the work they are doing and have been doing to advance the issues of gender equality and really support the push, and the agenda of the women's rights and recognition. And we should start with notable achievements or progress made in the fight against HIV.
I think the first thing to say is that we're not where we were with the HIV response 2 or 3 decades ago when I was first working on these issues of HIV. At the time, HIV was a death sentence. We're 40 years in terms of this epidemic. It's the longest and really most wide-reaching epidemic in the whole of this world of this last few centuries. I think the important thing is that we've achieved significant progress across the board in terms of accessing treatment. In many of our countries, and including in Kenya and in East Africa, we have seen progress, or at least on treatment. And women in particular are very committed, they adhere to their treatment. And so we've been able to reach many, many women with the treatment packages that exist to be able to live long lives living with HIV. And we have some very strong women in Kenya in the network of women living with HIV. WOFAC is one of them. We have the Pan-African Women's Organization of Women Living with HIV. These are women at the forefront who have stood. Grace Onyango is one that comes to mind. They have stood with other women. They have gone into communities and made sure that when women are pregnant, they get tested and that they are able to prevent new infections for their young newborn children. So we've made good progress in terms of that. And I think we've also made progress in making sure that we draw attention to the evidence of what is driving HIV. And the fact that we have new infections, they've gone down. They were much higher before. But unfortunately, what we find is that where new infections still persist is amongst young women and girls. So between the ages of 15 and 24, we have such high numbers of HIV in our region, in East Africa, across East and Southern Africa. We are the region that has the highest levels of HIV. It's a figure that we quote sometimes about how in South Africa alone, every hour, 5 young women and 1 young man are infected, every single hour, right? But in a country like Tanzania, there are 7,200 new infections amongst girls between 15 to 24, compared to about 1,000 men. So the number and the difference, the gap between young girls and young boys is really significant. So we've made some progress, but we also have a long way to go. In Kenya, there's 5,700 new infections every year of girls who are infected, girls and young women between 15 and 24. I can say the same for Uganda. So in Uganda, it's even higher. We have about 15,000 new infections. So they're very, very high numbers in our region in East and Southern Africa. And it's of great concern because we've made progress, but we're still lagging. So what's left to do now is to really focus on what is driving these new infections. Why are these young women and girls getting infected? So at least you hear what is happening in terms of the progress, and I can talk some more about the new infections.
Yeah. And you brought some few issues there, which I would like to go back to 40 years down the line. I think you can continue a bit by telling us what do you think. You can provide an overview of what is happening there, if you don't mind.
Well, let me mention that in Kenya, which and you're based in Kenya. Kenya, after the HIV, after the COVID epidemic, began to see a new trend emerging. And that trend was basically showing and indicating that in addition to HIV infections that we know are really high, and I said these are numbers where, they've come down, but they're still very high. You imagine 5,722 girls between 15 and 24 who are infected every single year in Kenya. But in our region, it is 4,000 new infections in the whole of Africa every week amongst girls and young women, right? So there is an inequality. And we find that boys of the same age are maybe a third or a quarter times more infected than young women and girls between 15 and 24. So there is a clear inequality. The boys are not getting infected, the girls are getting infected. So the question becomes then, who is infected? What we know is that they're being infected by men who are older than them. We know that one of the things that drives these infections is transactional sex. It means that they're trading sex in one way or the other. And there are multiple reasons why. Some of the reasons could be sheer intimate partner violence, which we know is strife. And recently in Kenya, there was a huge campaign against femicide and against the gender-based violence. We also know that high levels of poverty are driving girls to seek transaction and resources to be able to survive. So whether it's economic reasons or it's, sometimes it's just for basic needs. We find that even university girls, they need money for food or they need money so they're not formally in sex work, but they will transact and have sex in exchange for something in kind or something in cash. And this is becoming more and more and more predominant in our region. Of course, the other one is sometimes there are social reasons why young women and girls would transact for sex. But either way, it's risky. It's with men who are older. Interestingly, the research tells us that it's not like a large number of men. It actually, one man would be associated with 5 new infections. So the research is telling us that one man is doubling amongst multiple girls, and that's where the transmission happens. So it's a sex network, right, of infection. So this continues, and this theme of this International Women's Day is investing women to accelerate progress. So on this issue of HIV, for us, there needs to be a very serious investment, a deep dive into what is, these issues that are being driven. We know even by county, I don't have the figures right with me, but we know county by county in Kenya, and we can say the same in Uganda. We can say the same in Tanzania. Where are the infections coming from? It's not the same everywhere, right? And when you look at the counties that are driving the new infections, you will see the levels of poverty, or you will see a particular character. Perhaps this is a county where child marriage has been normalized, the marrying of young girls and taking a young girl as a so-called bride. These are children, but you will see the abuse of girls, and the data that emerged from COVID on underage pregnancy showed us girls at 10, 11, 12, 13 who are being infected, and they cannot be consenting. And sometimes it pains me when I hear, you know, in public, politicians and so on, talking about the misbehavior of girls. This is abuse. This is criminal. If a girl is underage and you have sex with her when she's underage, this is called statutory rape. And so blaming the victim is wrong. What we need to do is, yes, focus on educating the girls so they know how you get HIV, how to prevent HIV, but we also focus on the men so that the men themselves take responsibility for preventing the spread of HIV. Use condoms if you have to have the sex, but also recognize that this is an abuse. This is not acceptable behavior. So and Kenya has actually led the way by developing a campaign called the Triple Threat that is looking at the issues of GBV, underage pregnancy, and HIV occurrence at the same time. And these numbers are really, really worrying when you look at them, and we can't look away. We actually have to focus on them. 99 girls in Kenya get infected every week with HIV. There were 21,000 cases of sexual and gender-based violence reported at a facility of girls between 10 and 17. 15% of girls between 15 to 19 have been pregnant in 2022. So just those figures just give you a sense that there is something completely out of control. And so as we celebrate International Women's Day, in the advances we've made, we also take pause and ask ourselves, what is it that we need to do? How can we invest? Where do we invest so that we change the trajectory of these numbers? We cannot have them continue as they have been now. Otherwise, really, we're threatened in the future generation. We're the mothers of the future.
You mentioned the triple threat here, but I was wondering if UNAIDS is working on any specific targeted intervention and strategies being implemented on these cases. Of course, I mentioned Kenya, but this is a Sub-Saharan issue, like you've mentioned.
It is definitely one that we work on. We have an initiative in the region that is similar to the triple threat that we call Education Plus. So the evidence we have, and we're working not just us as UNAIDS. As you know, UNAIDS is a joint program of the United Nations. We work with 11 UN agencies, so UNFPA, UNICEF, UN Women. They're all partners to us in this on these issues. And so we are working with them. The data has shown us that if you keep girls in school up to the end of high school, that the chances of them preventing infection of HIV is 50% higher. So it's not foolproof, but it increases the probability of a girl getting infected by HIV, or rather it increases the prevention of HIV. It also increases the prevention of underage pregnancy. So what happened with COVID is girls were home, they got infected, they got pregnant in the safety of their own homes, right? So the program Education Plus pushes to keep girls in school as long as possible to the end of secondary school. And even then put them in vocational programs, what we call school to work transitions, to keep them as long as possible out of danger. Within that program of Education Plus, and the reason we call it Education Plus is that the Plus package says that while the girl is in school, teach her what she needs to know about her own sexuality and how she can be infected, how she would get pregnant, what can she do to prevent herself? So that's one. The second one is about making sure that if she's already sexually active, and this is quite controversial because obviously for parents, you want to make sure that, your daughter stays out of sexual activity until post-18. The truth is 10 years, 11, 12, 13, 14-year-olds are already having sex. So the age of sexual debut is earlier and earlier and earlier. And so we close our eyes and we bury our head in the sand and we pretend that they're not sexually active and therefore they don't have access to information. They don't have access to sexual and reproductive health services. And so that's a program where we're saying that while the girl is in school, she needs to have access to sexual and reproductive health services. It could be in the school or nearby the school, but she has to have access. Of course, we have punitive laws, or we have laws that prevent a young girl from going to school. I mean, going to get sexual and reproductive health services. So that's an area of the law where especially we work with young women's organizations who push for an earlier age of consent, an earlier age of access, so that they can access sexual and reproductive health services earlier. So this is part of the Plus package. It also looks at prevention of GBV. How do we start looking at safer schools? If it's a boarding school, how do you make sure that there is safety around in the boarding school? But also educating the community, working with men in the community so that they protect girls from gender-based violence. And then there's the school to work transitions, which I mentioned. Yeah. So this is a Plus package. We're doing it in Tanzania, in Uganda, in really across the region.
Interesting.
So that's a strong example. Yeah, that's one very strong example of the work that we're doing. Of course, you know, UNAIDS does data. And so we're tracking the data, you know, really trying to understand what are the multiple impacts, what are the inequalities that are driving this, and then distributing this to our partners and our co-sponsors so that they can hone in on their work in the area which they support. We also work with the agency of girls, getting themselves to be strong agents of themselves, really to be part of movements, right, that can take stronger positions as girls and young women.
Interesting. And Plus package is it's an all-inclusive conversation. And you really mentioned something there, which when we're having conversation with those who are working on the ground, the civil society officials, on the issue of law, I don't know if there are conversation to involve the judiciary as well in this conversation of helping the adolescent girls and young women.
This is a very important point that you're raising. There has been engagement, and we work a lot with, say, the parliamentary forums in the region. We work with the judiciary to really look, and again, our co-sponsor, UN Women, as well as UNFPA and UNDP, work even closer to the judiciary than we do. And I was in UN Women previously. And when we worked there, we were working a lot with the justice system. So one of the big issues, for instance, is the establishment of sexual offences courts. So this, I know, is happening in Kenya. I know that South Africa has sexual offences courts, and these models are being looked at in the region. While the law itself hasn't changed, there is a push now as women and civil society organizations have been pushing for there to be lists of offenders so that there is an actual mechanism to keep track of who are repeat offenders, who then are prevented from being able to carry on with their normal lives because they are actual sexual offenders. So that's one law that I know is being pushed. But there's also what we call the SADC model law on GBV. That model law was designed by multiple partners to try to define how to structure the law in multiple countries, okay? And those countries are picking that up. And there they are discussing how to ensure and are exploring laws, how to ensure that that when men are arrested or perpetrators are arrested, that they are given the highest level of sanction. Right now, there is a law in Madagascar, and there's a case that's happening as we speak of a man who abused a 6-year-old girl, and the law in Madagascar is castration. So there are countries that are taking quite dramatic laws like that one. I don't know whether that will hold, But I do know, and I see from our region in Eswatini, we were just talking the other day with an older man who was sharing a story. He was sharing a story about how when he was 20, he impregnated a girl at 16. And I said to him, you got away with it. And he said to me, that was then. Now I would be in jail for life because in Eswatini, if you abuse a girl according to the Sexual Offences and Gender Violence Act, you go straight away to jail for a minimum, I think, of 20 years. So it's getting more and more stringent, but it does require that we continue to push and mobilize. And so women's movements, the advocacy, the influencing continues to be really critical to be able to get real serious outcomes. And so we invest a lot in this area of the law and being able to end punitive laws, working with parliamentarians, working with leaders, trying to get, Kenya, I think we have a judiciary that would listen. Is my sense. So I think that's one that we should target more and more.
For sure. And from what I'm hearing from you, this requires an integrated effort. And this is why it's bringing me to this issue of zero discrimination. And on March 1st, we had the Zero Discrimination Day, but UNAIDS is saying all this month of March is a conversation that we need to be having. And we've been on the field again a lot, reporting on issues of self-stigma and discrimination, societal stigma, and all these discriminatory acts that make people who are already living with HIV and adhering to medication and doing all the necessary steps they need to follow on their treatment, not only getting hurt, but borders on the human rights infringement. Yeah. How do you think reducing stigma and discrimination is going to go a step ahead for us as society to help in this fight or in these issues to combat HIV?
Well, so the issue of stigma is quite a big one. As you know, may or may not know, but one of the things we do is in country by country, we develop what are called stigma indexes. These are basically work that we do with communities themselves living with HIV, and they work with the governments, they work with facilities to assess for themselves what stigma is like. So real recipients of the service. And we are able to then set a baseline for what stigma looks like. And we found that in general, the stigma is very, very high. And it's high, particularly from health workers, it's high, from service providers in general. But what we find is that once you establish programs with health workers and help them to understand why, what are the concerns that they have, their own belief, their lack of knowledge and information, then we already see some shifts in the way that they're responding on stigma. However, people living with HIV are not homogenous. People living with HIV are also injecting drug users. People living with HIV are intersectional. They're also sex workers, female or male sex workers. They're also men having sex with men or gay men. And we know that these are communities who, in our countries, are stigmatized against, are discriminated against anywho. And so for us, the Zero Discrimination campaign is so important because when you stigmatize or discriminate against a person living with HIV or a person who's vulnerable to HIV or at risk of HIV, then what you're doing is actually leaving a loophole for a person who would then in turn infect others who are not necessarily the same population group. I mean, sex workers have sex with people who are not sex workers, right? Who are in the general population. And so if we don't do everything we can to protect what we call key populations or vulnerable populations, then you risk spreading HIV even more. And so we want to really stay on this issue of zero discrimination because it prevents access to health services. We get rights, we get health. We lack rights, we lack health.